Hi, this is Will Parker, and you're listening to another edition of Ashland on the Air. This is episode 7, and my guest today is Kate Hepner-Smith of Orthopedic and Spine Therapy right here in Ashland. Why don't you tell us a little bit about yourself?
Well, first my name's Kate Smith. I'm a physical therapist with Orthopedic and Spine Therapy. I'm a native of the area. I was born and raised in Bayfield, Wisconsin. So I was always surprised when I found that I actually came back to live here because I never thought I would. But, when the time came to decide where I was going to come and work, I couldn't think of any other place I'd want to be than home. So here I've been. It's been about 6 years that I've been with Orthopedic and Spine Therapy, working on treating chronic pain and trying as best as I can to serve some of the more underserved diagnoses in the area. We kind of really are a specialty clinic focusing on chronic pain. Of course, I focus on women's health issues. We do a lot of unusual treatment techniques. I'm trained to be treating, it's called dry needling, which is kind of a physical therapist performed type of acupuncture, which I use to treat chronic myofascial pain and chronic headaches and back pain. So I'm married to a wonderful husband. His name is Corey.
Where did you go to school for physical therapy?
I'm a graduate of the College of St. Scholastica, Duluth, Minnesota.
Oh, nice. Okay.
Minnesota. I know. So
Okay.
it was a good experience. One of the subspecialties that we have here, and like I said, we are kind of a specialty clinic, is that I treat a condition called lymphedema. Basically what it is it's swelling, chronic swelling. What I have is I see a lot of women who have experienced breast cancer, so lumpectomy, post-mastectomy, and that interrupts the fluid movement through their body. And often they end up with swollen arms, swollen breast tissue, swollen in the areas of the axilla. And what I do is I reroute that fluid through a series of massages and develop a compression system that allows them to restore the fluid movement through their body and decrease the swelling.
And as far as the Ashland area, do you find that there are injuries that are more prevalent, in this area, as far as Ashland goes?
Absolutely. I've worked in several areas between Minnesota and Michigan, and I find that the prevalence of chronic pain issues in the Ashland area are actually quite high compared to other places that I've been. A lot of lumbopelvic pain, chronic headaches, certainly a large number of women's health issues, and I don't know if that's necessarily because there's more information about it and doctors are diagnosing it better, or if it's just Ashland. I'm not entirely sure. Mm-hmm. But certainly the chronic pain is quite high up here. And sometimes I think that might have a little bit to do with the environment. We have long winters with less activity. I have a favorite saying, and I wish I had come up with it myself, such as that, for those who think they have not time for exercise, they must eventually make time for illness. And I think that's absolutely true in the Ashland area. It's just long, hard winters, and perhaps not the outlets that people have in bigger cities to find activity and to have good mental health, which is very much related to your physical health.
Mm-hmm. Oh, I can relate. I read in your bio there that you had said that people assume that your place is mostly for women. Do you mostly see women, or?
Absolutely not. In fact, that was an article that the person actually kind of misquoted me on. I certainly do see a high level of women here, and I think one of the reasons is that women are more readily to talk with their doctors about some of their health issues, mm-hmm. and we tend to have more female referrals. But certainly I see quite a few men for many of the same problems that we see women for, not just orthopedic problems, but chronic pain, pelvic floor problems, imbalance, chronic headaches, that kind of thing. Mm-hmm. Quite a few.
And as far, like we were talking about the seasons, do you find that some of this chronic pain is worse, at certain seasons?
No.
No?
Honestly, no. I think we see, well, actually, I would say, yeah, we probably see more chronic type pains over the wintertime and in the early spring. We tend to see more orthopedic post-surgical type things after the springtime because I think that's when people feel that they can recover the best and not have to deal with, limping in the snow or not being able to take care of themselves. But, if we go back to that comment you just made, I think what I was trying to refer to at that point was that most people think that our women's health program is just specifically for women, when, to be quite honest, we see quite a few men as well for that. So treating male health problems, which is what I was trying to discuss with that particular person who misunderstood me.
And as far as the chronic pain goes, where do you find that, as in the part of the body, where do you find that most of the chronic pain is?
Chronic low back and pelvic, chronic upper back and neck, and headaches. A lot of headaches.
Could any of that be contributed to the computer?
Absolutely. In fact, I just had a conversation with a gentleman today, and I asked him, he came and he's complaining of chronic upper back and neck pain, and I said, well, what do you do all day? And he said, well, most of the time I'm at the computer. But certainly, desk jobs, that when you're in one position all day long, by gosh, your body's going to pay for it eventually.
Oh, absolutely. Is there anything, as far as, let's stick with the chronic pain because I have that myself, my back and my shoulders, and I'm not right.
But certainly, a person's body, the way that we're created, we're designed to be aligned in a certain way. Gravity works through our head, through our neck, through our shoulders, back, hips, and feet. So when we change how gravity works through us by either altering our posture for a prolonged period of time or having weakness, it certainly plays a toll on muscle pain. Our body exchanges healthy fluid or poor fluid with healthy fluid through movement, particularly in the spine. So if you're sitting for a long period of time and you aren't getting that compression and relaxation of your spine, well, certainly, you can build up some cellular waste in your spine that can cause pain as well over time. So.
Is there any kind of preventative measures that a person can take to ease or prevent some of the chronic pain?
Oh, now you're never going to get me to stop talking.
Okay, cool. That's awesome.
Absolutely. Well, it's true. When you do not exercise, when your body does not move, your body hurts. It's a simple fact. Regular daily activity, walking, light aerobic exercise, movement is certainly the best thing you can do for people who are in a sitting position for a long period of time to move, to stretch through your anterior chest wall, to contract your spinal muscles, to side bend and rotate your spine, just to get some sort of movement. I do a lot of ergonomic training in the Ashland area, and I always, walk all of the people through, well, here's what you can do at your desk. You don't even have to get up. Just move your arms and twist your head and those kinds of things. And I give them a handout and tell them to slap it right by their computer so that they can see that every hour and just get some movement. We're built to move, and that's what we do at Orthopedic and Spine Therapy is we restore movement. That's our goal. And when you don't have it, you certainly hurt. So maybe not right away, but it certainly catches up with you.
Well, and I didn't think it was going to happen because, like I said, I looked at some of your literature, and a lot of it was involved with women, but it has intrigued me because, like I said, I do have pain. Well, Kate, it's been a real pleasure talking to you. And how can folks get a hold of you?
Let's see. Well, you can call us at 715-685-9656.
There you go. And where in town are you located?
We are at 220 3rd Avenue West.
Okay. Great. All right. Well, it was so nice meeting you, Kate.
It was great to talk to you, and hopefully I'll see you soon.
Okay. You take care of yourself.
You bet. Have a great day.
You too. Bye-bye.